Good afternoon, everyone, and or morning, depending on where you are. Thank you so much for joining us today. We're thrilled to have you with us. While we give everyone a second to join the room, we're going to launch a quick poll to learn a little bit more about all of you, and then we will get started in a minute or two. And thank you all again so much for joining us. My name is Dr. Kate Runne-Janczy, and I'm the Chief Academic Officer here at Science Interactive. We have a long history of supporting both the basic sciences as well as allied health programs in offering hands-on kits for students who are working both online or on campus on their skills labs. I'm thrilled today to be joined by Latoya Hill from Barton Community College. Latoya has been using Science Interactive's hands-on and virtual labs in her Farm Tech program at Barton Community College for almost 10 years now. In 2023, she was recognized as a recipient of the Science Interactive Golden Goggles Educators Award in the category of Innovative Use of Technology. And she was honored for creating a seamless experience that integrates virtual simulations with hands-on labs to prepare students for real-world pharmacy practice. So thank you so much for joining us today, Latoya. We're thrilled to have you here. So to kick things off today, I'm going to share a little bit about us and what we do and how we support allied health programs. And really, the impetus for us to support allied health programs is that we know that these students are going to be changing lives. We know that there is a dire need for folks in the medical assisting, nursing, and pharmacy technician world. But that these students often are non-traditional students. They're coming with a different perspective, and that's where we look to support these students. So to give a little bit of framework for us, these are probably some stats that you're familiar with already. We know that many of the allied health programs that are out there are under pressure to grow. The number of jobs in many of these sectors, medical assisting, nursing, pharmacy technician, are growing much faster than the broader average growth in the U.S. job market. We know there is a desperate need for filling these workforce gaps because of both our aging population as well as retirement, burnout, folks leaving the professions at the same time. Now, with that, we know that there is, if you want to just go back for a second, with that, we know that there is a real drive to look at alternative ways of presenting these programs rather than having students come to campus, not only to help fill in some of that pressure to grow, but to also reach a different audience of students. Many of the students who are coming back to these programs are non-traditional students. They've already worked jobs, whether in healthcare or outside of, and are looking for a career change. And in many cases, qualified applicants are being turned away from these programs. And that's really where Science Interactive looks to help. So if we go on to the next slide, how can we meet these students where they are, no matter where they are, whether it be on campus or at home? That's where Science Interactive can really step in and support these students. And we do this in two ways. So with Science Interactive, we offer a combination of hands-on skills labs and digital curriculum. And so with that, a student who works with Science Interactive is going to receive a kit that includes medical grade equipment for them to work on at home. They'll have guided protocols with videos and images, allowing students to practice the same skills that they would practice on campus or in the clinic, no matter where they are. Now, this is combined with digital skills labs that allow students to replicate some of the clinical decision making, clinical reasoning, or scenarios that they may face once they are in the clinic, such as good customer service, how to use drug dispensing systems, best practices in communicating with patients. And combining this allows students to really get a quite holistic view of these skills prior to entering the clinic, no matter where they are. For us, our real goal is to make sure that students, no matter if they're on campus or if they are at home, have a consistent experience, that they're going to encounter the equipment that they will use in a real life environment before they get to that clinic, that they have consistent protocols, no matter where they are, to learn how to perform these skills, as well as having that proof of practice that comes through the review and grading with our LMS integrated platform. Um, At Science Interactive, we support three different clinical programs right now: medical assisting, nursing, and pharmacy technician. But we also support many of the basic science prerequisites that are being used by these programs, including anatomy and physiology, microbiology, genetics, general organic and biochemistry, and all of your basic sciences. And so, really, when you look at it, we provide a really holistic and robust experience for our students who start with us from the beginning prerequisites through their allied health programs to have a very consistent experience in an online lab environment with a very predictable pace of doing that work. For our programs today, I'll dive in a little bit more detail into the three offerings we have. The first is our nursing program. Our nursing program has 22 hands-on and virtual skills labs available, and there's a couple of different ways you can approach using these. Our standard kit offers all 22 labs together, so you have everything available to your students. But we also offer skill packs. So if you're looking to focus in on maybe one or two particular skills, maybe patient assessment and phlebotomy, you can use the skill packs to really tailor exactly what those students are working on and using. In addition to that, you can customize. If you want maybe 5 or 6 skills that are not grouped in a skill pack, you can certainly put that kit together and we'd be happy to support you with that. For our students here, we cover everything in nursing from vital signs assessments, electrocardiograms, through assessing pains, head to toe assessment, up to performing blood draws and medication administration via injection. For our medical assisting program, we have 18 labs available today. That covers everything from the basics of anatomical orientations and medical terminology through best practices in aseptic technique, medication administration, as well as those vital sign assessments. And then finally, we've got our pharmacy technician kit that has 17 hands-on labs and virtual skills available. That covers everything from customer service, how to use drug references and validate DEA numbers, up through measurement systems, how to measure appropriately, repackaging, compounding, and aseptic technique, with our most complex lab probably covering our preparation of hospital drugs, how to prepare an IV. So with that, that's a little bit of background on Science Interactive and how we support our allied health skills today. I am going to hand things over to Latoya to share a little bit more about how she's incorporated Science Interactive into her pharmacy technician program.
Good afternoon or good morning. My name is Latoya Hill. I'm the coordinator instructor at Barton Community College over the pharmacy tech program. I've been with Barton since 2014. I've been teaching a long time. I'm very proud to be a part of the pharmacy technician space. So I will get right into it and share a little bit about how I integrate Science Interactive into my program. So I use this program primarily in my advanced pharmacy operation course. I service about 100 students annually. My program is online and it is geared toward the pharmacy technician space. So with advanced pharmacy operations, we primarily cover daily activities in pharmaceutical practice settings. A lot of the topics include non-sterile compounding, sterile technique, drug delivery systems, and you can kind of see where the items in the kit would tie into what we're teaching. So it helps to let students have exposure to these concepts and the tools that they need to complete it in real time. And we utilize this through live sessions via Zoom. We do group sessions, and for students that may have issues with concepts or technique, I also offer one-on-one sessions. Once they've perfected their technique and they're ready to submit for grading, I do offer the option. They can do a live lab with me, or they can submit a pre-recorded submission. I know some people get jittery when they're online on camera. So I try to work with the students and do what makes them feel comfortable. So this is the meat and the potatoes of it. Spending so much time trying to piece together materials than actually teaching. So before I met with Science Interactive, my whole goal was to find something where I could have students get an experience of more than just paper and pencil and case studies. I wanted them to actually have an experience as similar as to what they would have inside the pharmacy. Trying to outsource multiple materials from different vendors, and even, trying to ship them to individual students, especially when your program is online. It's kind of a hardship for the instructor and the student, but this is where Science Interactive came in. So this is basically a one-stop shop. I was able to get the lab kit built to how I needed it for my program, and students were able to get access to the materials that they needed to complete my course. So with Barton, the kits are available at our campus bookstore. They will purchase the kits and they're shipped directly to their students. My students, like I said before, are online. So this takes the hardship out of, trying to order different products from Amazon, or, they get it all in one place. So we do utilize the cloud. So students will complete their lab coursework online in conjunction with the text that I use. And they have the materials in the kit for the hands-on portion. So a lot of the scenarios inside the cloud and the activities replicate scenarios that probably would be pretty hard to do online versus in a real life setting on campus. So I'm very thankful for that. Photo uploads and video tools, like I said before, they help the student and me bridge the gap. Even though we're online, I try to make the experience be as close as in person as possible. So for them to be able to upload photos, use videos, to record themselves, and even the live lab portion, they can get real live feedback from an instructor in real time. And they also, the most important part, get access to tools that they would actually use and see inside of a pharmacy. And another important point for any programs that may have to deal with accreditation, the labs, the skills, the content, all align with ASHP standards. This is geared toward pharmacy, but they align with those standards, and it supports our program compliance, and it makes no extra work for me. So I love that part. Next slide. Yeah. All right.
Great.
I'll turn it back over to you, Kate.
Thank you so much, Latoya. We appreciate you sharing your experience with using the kits. So taking a look here, we've got a couple of questions that have come through. How did you go about selecting the skills that you were going to include in your kit from the greater list, or do you use all of them?
I actually use all of them because I want my students to have the most broad experience as possible. I want them to be able to at least have exposure to everything. But the course is so flexible, and the options that you guys offer, it is super flexible, and you can build it to your customizations or your preferences.
Awesome. And then how do you approach the safety element with your students when they're working at home?
So kudos to you guys again. Your program does have a built-in safety first before they even start the course. For this particular part, I do have students attend an online orientation session. This is before we even begin the labs, and we go over all of the safety precautions. I answer any questions that they may have and make sure everyone understands. Please keep your kids safe, put away from small children, pets, or anyone else that might ingest any materials. But yeah, we have live sessions that cover all the safety concerns that anyone may have, and we haven't had any issues.
And so I think the last question we have here is what recommendations do you have for a faculty member who maybe is moving to an online course for the first time for their allied health program? How would you recommend approaching that and approaching what skills you have your students do at home?
I would say you could start with the skills that you deem most important. Like I said, this program is absolutely buildable. You could start with one or two skills just to get the flow of things, and see how that feels. The most important thing I would say is communication with your students. Um, Having that one-on-one, if you could utilize Microsoft Teams or Zoom, um, get everyone together and talk things through. The most important thing I think is making them feel comfortable with the materials. Doing an online course can be intimidating to some people. I know I've heard from students, oh, I got this big box of stuff, what do I do? So communication is the number one most important thing. Just making sure that your goals are clear, the content is clear, what you want them to get out of this experience. And I think you'll see that it's a pretty seamless experience.
Awesome. Well, thank you so much, Latoya, for joining us today. If you are interested in learning more about our allied health programs, we would love to invite you to use our QR code and schedule a demo, and meet with our team to learn more about what we offer. We can get you access to a sample kit as well as some of the curriculum. The other thing I would love to share with you all today is that we do an annual lab report, covering a wide swath of topics from faculty strain, student readiness, how students are adapting to performing labs online, where allied health is in terms of its online move, as well as AI. So we really would love. We have one more question before we hop off, Latoya. I love it. Um, so encourage you, if you're interested in the report, to use the QR code there to access the full report. It's very lengthy. It covers a lot of ground. We had a question pop in. Do you do anything with chemotherapy compounding in your course?
No, at this time we do not. It's just basic aseptic compounding. Um, we compound creams, ointments, suspensions, emulsions, things of that nature. It's geared toward retail mostly, but we do some IVs, but no chemo at this time.
Great. Thank you all so much for joining us this afternoon. Latoya, thank you so much for your time. We greatly appreciate it. And we look forward to talking with all of you more about your allied health programs and how we can best support you in the future. Thank you so much.